Hello, within this video we are going to explain how the pre-operative checklist is going to stop being on paper and will be recorded on the EPR system from the weekend of the 23rd of November. To record the pre-operative checklist within EPR, you need to have the patient open within the system. To access the paperwork, you need to go to Ad Hoc on the top toolbar. Within Ad Hoc, you need to select the surgery folder and select the pre-operative checklist. Once selected, you need to press Record. You need to complete the relevant information as such, as you would normally do on the paperwork. And once done so, you need to go to the bottom of the paperwork and you need to select whether the patient is ready for transport to theatre. If the patient is not ready for transport, please select no, as you will be unable to save the form, but if the patient is ready for transport, you can select yes. By doing so, this will trigger to the theatre staff that the patient is ready for collection. Also within the checklist, we need to ensure that we complete our infection prevention and control risk assessments. You need to work down the form and answering the questions as appropriate, and at the bottom you need to confirm that this section has been completed. Once the form has been completed, you can select the green tick and press sign. Once the form has been completed, you'll be able to see that within your documentation. Once you click on the pre-operative checklist, you'll be able to select the Modify button and make any changes where appropriate. Theatre staff will also come and have eyes on the form when collecting the patient. If you are working within maternity department or in ICU, you'll be able to see the documents within your relevant end pages. Please note, you are now able to track your patient through the patient journey of the theatres by going to View and selecting the Perioperative Tracking section. This is used by the theatre staff, however, you will be able to see where your patient is within the theatre journey. So we can see that this patient has a procedure scheduled for Bronte, and when moving across this section here, the status will update of where they are within the patient journey. For example, anaesthetic started or received in recovery.